session. Delighted to say we're joined by highly esteemed consultant ENT surgeon and ENT specialist, Professor Jaydip Ray, to talk all things balance, physical balance. So it should be a very interesting topic. Professor Ray, thanks so much for joining me and Top Doctors UK for this podcast. And if you'd like to maybe, before getting into the topic, tell maybe the viewers about your background experience.
Thank you, Connor, and thank you for the invitation to discuss this very interesting topic with you. So I am a consultant otoneurologist and ENT surgeon at Sheffield Teaching Hospitals and a professor of otology and neurotology at the University of Sheffield, as well as a professor of ENT at the Sheffield Hallam University. I've had long experience with balance disorders, and that has been one of my primary focus for both clinical and research work. And increasingly, with an aging population, that has become a much bigger priority because we are all going to hopefully live longer, and with that will come the challenges of maintaining your balance to have a purposeful and healthy life without any mishaps and falls or injuries. So I have had fellowship experience during my training in Australia, Sydney, with one of the biggest balance doctors, Professor Bill Gibson at Sydney University. Then I have had further fellowship training in Stanford in California, USA, which was a big neurotology center when I visited Professor Rob Jackler, who's done a lot of work on neurotology and skull-based work. And then subsequently I developed on settling down in Sheffield, our own regional center for neurotology and balance lab and balance treatment center.
Excellent, Professor Ray. Thank you so much for the thorough background information. You have a wealth of experience with regards to balance, ENT conditions, but particularly balance is our focus today. So if you want to maybe delve into this first question, what are the primary systems in the body that contribute to maintaining our balance?
So when we talk of balance, we are essentially talking of posture and balance. Posture as we are, upright, horizontal, or at an angle, and that's maintained by the balance organs and the balance function in the body. To do that, the body has to take in three different bits of information. First is a set of visual clues. So we need to know our environment. So vision is the first primary input into the system. It allows us to get a perspective. So obviously we've got the walls vertical, the floors are horizontal, and then there are other bits of furniture around. And that gives us an estimate of our position relative to our surroundings. Then the next input is from joint and gravity sensation. So joint gravity, so wherever your limbs are folded, you get a resistance on one side and relaxation on the other side. And the gravity gives you resistance downwards and freedom upwards. So you know you're vertical, you're upright, which is why when, astronauts, cosmonauts, they come back down, because they are in a weightless environment for months, days to months, and it can be many months nowadays, you might struggle to find your feet, which is why they have to rebalance themselves once again. And the third and important bit which comes in our domain are the balance organs. So the balance organs are little organs inside the inner ear, which are like the stabilizers in your cruise ship, essentially. So they tend to maintain equal balance on both sides, so we do not tilt to one side and can maintain our vertical position in regardless of whatever the situation is. And they detect balance in three different planes: horizontal, vertical, and at an angular, and acceleration and deceleration. So there's those domains which are going into the brain at a rapid pace, and the brain, being a supercomputer, is computing all that information and telling us which way to look, which way to stand, which way to move, tilt, turn, twist, bend, run.
Fascinating, absolutely. There's so much going on. Actually, a lot of things for the ears and I suppose the what role does the brain have then in balance?
The brain is like a superconductor, so it essentially is taking in all that information and telling the whole body how to um, act and react. So the brain is telling the limbs which way to fold, which way to relax, where to put resistance down. Also, if you're turning, twisting, how the eye should follow the direction of your turn and the travel. So it's a supercomputer and it's a superconductor. So it's conducting all that in microseconds and milliseconds. And there's a part of the brain which is called the cerebellum. If you think of the brain as the head, it's like a little bun at the back. And that is the main part which decides on the finer movements and coordination.
Fantastic, Professor Ray. Thank you for that lovely insight. Very fascinating to see the connection there between the ears and the brain. Leading us nicely then to question number two. And what are some common symptoms of balance disorders and how can they impact our daily lives?
The two primary sort of um, presentations of balance disorders could be either a spinning sensation, which people generally describe as vertigo, or is oftentimes mislabeled as vertigo as a diagnosis,
Oh,
but vertigo is actually a symptom. And
okay.
so that's one of the symptoms. And the other part is disequilibrium. So you feel like being spaced out or lightheaded or dizzy, as patients or people describe it. So I'm unstable, walking on clouds, etc. With either of those can come other sensations, which could be nausea, vomiting, blurring of vision, the the inability or difficulty in focusing on a target, being very anxious and hyperventilating because of the loss of control, and also other ear related symptoms can come together with many of the conditions, which might be like hearing loss, ringing noises in the ears, etc.
Excellent. Thank you, Professor Ray. Very important to, have a nice, clear outline of the symptoms in case anybody is suffering from these. They can actually contact somebody like yourself. So very important to find out the symptoms. And then how do age-related changes affect a person's balance and increase the risk of falls?
So with age comes its own advantages and disadvantages. With age comes wisdom. We slow down a little bit. We are a bit more risk averse, I think. So
Yeah.
that's the safety net of aging. But again, there are issues related to wear and tear of body systems. Muscle strength decreases, particularly lower limb muscle strength decreases, unless people actively look at their core stability and address it. The balance organs themselves wear out slowly because the cells tend to drop off quite a bit. And we've had one of our very bright PhD students who's researched this in great depth under Wellcome Trust Fellowship, has looked at the death of balance organ cells. And we are now researching the possibility of developing stem cells in replacing them to replace the loss of the balance organ cells. But obviously, that's in the future. But currently, what happens with aging is that loss of stability results in a risk of falls, and a fall might be injurious, which might result in a breakage, which might put a person in bed out of action. It's a cost to the person. They might be incapacitated for quite a long time, not being able to work, etc., etc. So it's a personal cost, cost to society, cost to the employer, cost for employment.
Absolutely. It can have a huge influence on daily life and huge impact for people. So it's important to be aware of that. And then going on to now vestibular disorders. And how do vestibular disorders, what role do they play in balance issues? And what are some examples of these conditions?
So vestibular disorders can be of various types. Thankfully, there are far fewer than people think. There are some commoner ones, there are some less common ones, and I'll mention the commoner ones first. The commonest one is benign positional vertigo, BPPV, benign paroxysmal positional vertigo, where people get a sensation of spinning and vertigo for a few seconds every time they do certain maneuvers or postures. So if they're getting in and out of bed or lying in bed and the world spins around and they feel as though they're falling through the bed, or when they get up, they feel like they might be falling over, and can be damaging if you're elderly and getting out of bed and going to the toilet maybe in the middle of the night. Then there are other conditions like Meniere's disease, which is another common one, which is associated with relapsing, remitting attacks of rotatory vertigo, nausea, vomiting, and a hearing loss. Hugely debilitating, and there's a lot of suffering that comes with it, and starts quite early in life and carry on to late middle age and later on as well. Increasingly, we are aware of migraine-associated vertigo, which may not even have migrainous headaches, but have very typical migrainous features like other triggers, which try to trigger the migraine, but the vertigo is incapacitating. Increasingly, also, we are aware of a condition called PPPD, or paroxysmal perceptual disequilibrium, which used to be called visual vertigo, where people find it very difficult to cope in visually challenging environment like supermarkets, coming down escalators, crowded places, movie theaters, where sharp, fast-moving images can cause disruption to the balance system, so that they increasingly retreat to their home surroundings and avoid outdoors. There's also another condition called superior semicircular canal dehiscence, which is also called Minor's syndrome, MINOR's, apostrophe S, after a surgeon called Lloyd Minor. And that is related to an anatomical defect in the balance organ, which can also result in episodic features like bobbing of the horizon if you go over a berm, hearing your own voice, hearing your own footsteps, or to the extent some people feel that they're being followed all the time if they're outdoors. So those are the rarer ones, but the first two are the commonest ones, BPV and the Meniere's. But it's also important to understand that, or be aware of the fact that it's not just the balance organs which cause balance disorders or the vestibular disorders. It's also other medical conditions, polypharmacy. Many people take lots of medications, particularly elderly. They might be on several medications on the go. So each additional medication above 4 for a person increases their falls risk exponentially. There may be other conditions like postural hypotension. When they stand up, they may feel dizzy, but that's not necessarily a balance organ problem. Brain injury, history of brain injury renders people unstable for a long time, and they struggle to compensate. Neurodisability like MS, movement disorders, etc., can cause problems. But vestibular toxicity, chemotherapeutic medications, or some antibiotics can knock balance function off for quite a long time. Anxiety itself and hyperventilation can result in balance symptoms. So it's very important to be aware of the fact that there are other conditions which bring balance symptoms to the fore, whilst it may not just be the balance organ at fault.
Absolutely, and it's very important to stress that as well. That many other conditions, maybe heart conditions as well, like you mentioned. So it's very important to distinguish. Thank you very much, Professor Ray. That's fantastic. And then our next one is a very interesting one now, changing it to more about physical rehabilitation or physical therapy, and how can this help people with balance disorders?
Physical therapy actually has an enormous role in rehabilitating persons with balance disorders, and also in supporting the recovery from loss of balance function. So physical therapy works in two ways: allows compensation of the lost coordination between the three systems. If you remember when we said earlier, is the vision, joint and gravity sensation, and balance organs. They've stopped talking to each other in a civilized fashion. So physical therapy's aim is to bring them back together, talk together, and get on with the business. And they therefore have a series of exercises which puts the bodies through a series of challenges. So patients are encouraged to do the activities they stopped doing as a result of worries about falls and balance loss. They also advise on exercises to improve core stability, so exercises to increase the strength of the core muscles, abdomen, hips, and the lower limb muscles. Increasingly, within physical therapy, we have instituted more and more virtual reality and augmentation reality. So we started about 15 years ago with using Nintendo Wii Fit balance games,
Oh,
and we
excellent.
won several awards for that on a research project. And
Wonderful.
patients still can't believe that they can come to a clinic and be given gaming as a prescription.
Fantastic. So inventive. And like you say, you would never expect that, but it has such benefits.
Yeah.
Oh, fantastic. So patients, like you're saying here with gaming and other examples, they can actually really enjoy the physical rehabilitation, which is fantastic. Wow, excellent. So now we're on to the question number six, then, Professor Ray, and that would be what lifestyle modifications can be made to improve balance for people who are at risk of falls or balance issues?
So it's a fine line to tread, to be honest. So a lot of balance disorder patients who have significant symptoms tend to avoid movement, and that in itself is a downhill trend, because then the balance function is not being used, and so it's getting more and more decompensated, and that's where again physical therapy comes in. So lifestyle measures are a movement avoidance probably isn't the best thing, but seeking help and support and working together, and also understanding it is not a quick fix. It is a system that has to realign with the various aspects of us being mobile and safe. So it requires exercise, it requires daily engagement with that exercise. That's the biggest lifestyle adaptation people have to have. The second thing is to have the reassurance that there isn't anything sinister, for which we obviously would investigate, sometimes even with a scan. And time and again, patients come with a huge emotional overlay because they've been passed from pillar to post without any either diagnosis or a solid treatment. And sometimes they start to believe that the rest of the world doesn't believe them, and the clinicians are kind of thinking they're malingering, which they are not. So having that empathy, having that understanding, suppressing the acute symptoms, which are acute vertigo, nausea, vomiting, will help a lot in the person starting to feel normal and good. But that normalcy will not last unless they engaged in that exercise regime and have a regular sort of follow up and follow through. There are multiple dietary triggers which patients need to look out for. Common ones being high salt diet, and mind you, it's not just added salt, there is salt in processed food and all sorts of other food materials. Checking that. A lot of coffee, excess coffee will trigger balance symptoms. Excess fizzy drinks, which have high sort of caffeine content, will cause that. Some patients get triggered with red wine. Surprisingly, why not white or beer or spirits? Don't ask me, but it's the red. Uh,
The
so
red,
there
wow.
is there is hope if they if they can't be teetotal. And being dehydrated, being stressed, being tired, being unwell, all those will trigger balance issues. So being relaxed, being having a good understanding, not being too anxious about the balance system is very important in their rehabilitation. But equally, being gung ho will put them at a risk of falls. So the falls issue we can talk at length because elderly patients tend to either be in denial sometimes about the reduction in the balance function. So the house may be set up in the way it was 40 years ago, maybe. There may be clutter, there may be rugs, there may be magazine racks on the floor, there may be cuddly toys from grandkids, there may be little pets running around. So all those are trip hazards. Staircases, steep staircases without banisters, without grab rails, high-rise baths, they are all issues with lifestyle, and that needs to be addressed. Usually the local hospital occupational therapists are very good in examining those and advising them. But equally, it can be done with a significant common sense approach.
Fantastic, Professor Ray. Leading us then nicely to our final question, which is quite similar, but are there any technological wearable devices that patients might be made aware of or they can wear if they have any balance issues?
Technology has really come for a long way for balanced patients, to be honest. There's still ongoing work in this domain. As I mentioned, augmented reality and virtual reality is becoming more and more popular in sort of utilizing their benefits in rehabilitating patients in a more realistic, real life fashion rather than doing some sort of drab exercise which they do not engage with over a long period of time because they tend to not engage with it over a long period. So compliance is low. The wearable options for headsets is very good. So we use the Oculus Rift nowadays, which are 3D surround virtual reality. That gives them confidence that, well, I have performed this exercise, so I should be able to get going outside. Um, we also have our mobile phones with us all the time. That checks our balance
Yeah.
function. The pods that we use for earphones have a bit of a balance function stability check and falls risk assessment built in nowadays. There are wearable sensors that can be used. We've incorporated wearables in our clinical practice whereby we put wearable sensors onto the shin of the patient and test what's called a Q-tug, and that's made by one of our Irish counterparts, which was a startup, and it's really done very well, and has been used in the paramedic world as well. Can be used as a domiciliary visit. So it's put on the shin of both legs, and then the patient's asked to do a certain amount of walk unaided, without a stick or without support. And they walk back and forth, and it immediately gives the data on the gait speed, gait stability, and falls risk assessment. And that is very graphic and clear to the person seeing that. They would say, like, you've got a 70% falls risk, or you've got 80% falls risk, so we need to look after you, or you need to look after yourself. Then the message is a lot clearer so that they might be happy to use a walking stick for a support. And with a walking stick, instead of being on two legs, you suddenly have three. You have that wider base. So if you wobble, chances of falling is much lower. So that's another variable. And the other variable that is most useful for elderly who are at high risk of falls is the falls bracelet or the falls necklace or the falls locket. Because if they're on their own and if they're unlucky enough to have had a fall, regardless of the cause, they don't want to be in what's classed as a long lie so that they can't get off the floor to call for help. So those are linked to responders. So those are available again through the healthcare system, and they are absolutely wonderful in saving precious minutes and hours whilst the patient has to wait for help. And I would thoroughly recommend that sort of approach. There are also very good falls prevention booklets which we provide. We've got our own in Sheffield which we give out to patients, and they advise them on how, firstly, to avoid falls, secondly, if they are unlucky to have a fall, how to get help, and thirdly, there are ways the person can retrieve themselves from the floor onto a couch or a chair, on how to get up from there without hurting themselves. So those are the main areas I would suggest we look at and address, and often times make a record of the falls, because sometimes patients are in denial and they kind of don't make a record. They may have 5 falls, they will recollect only the one that was bad.
Absolutely. So awareness and now awareness of technological options for them is so important. And thank you for touching on that, Professor Jaydip Ray. Thank you so much for your time again to for joining us at Top Doctors UK for our latest podcast session and a really, really thorough insight into balance disorders. And if anybody would like to check out more information about Professor Jaydip Ray, they can check out his Top Doctors profile over at topdoctors.co.uk. And Professor Jaydip Ray, thank you again so much for your time. Thank you.
Thank you, Connor. You were breaking up at the end, so
Oh, oh, just at the end. Luckily, our Wi-Fi connection was very good.
yeah.
Oh, and thank you so much, Professor Ray. It
Excellent.
really was a very, very good interview. So thank you for your time.
Thank you very much. So I'll have a look at it once it's done. I'm hoping. Super.
Absolutely, yes.
Thanks.
Actually, before it goes onto YouTube or your Top Doctor's profile, you can review it first and see if you're happy with it or if you'd like to make some changes.
Lovely. Thanks, Connor. Go and enjoy the
Thank you
rest
very
of
much,
the
Professor Ray.
wonderful afternoon.
Oh, absolutely. Yeah, take advantage.
Yeah. Bye bye.
Thank you for your time.